video we will talk about acid-base balance. We will discuss in detail about acid-base balance, types of buffer system, protein buffer system, carbonic acid bicarbonate buffer system, phosphate buffer system, carbon dioxide buffer system, and kidney buffer system. So first let us see what is acid-base balance. The body needs the right balance of acid and base components in blood to function properly. This is known as acid-base balance. This is measured on a pH scale. An important property of blood is to maintain the degree of acidity and alkalinity. Blood acidity increases when level of acidic compounds in body rises or whenever the level of basic compounds in the body falls. The blood becomes alkaline in the reverse processes. In this way, body tries to maintain a balance. Let us now discuss what is a pH scale. The acidity or alkalinity of any solution, including the blood, is indicated on a pH scale. For example, water with pH around 7 is considered to be as neutral. Sulfuric acid with a pH between 0 to 2 is highly acidic, whereas pH of potassium hydroxide, which is a strong base, is in between 12 to 14. Blood's acid-base balance is precisely controlled because even a minor deviation from the normal range can severely affect many organs. Body uses different mechanisms to control the blood's acid-base balance. Let us now discuss what is acidosis and alkalosis. These are two abnormal conditions that may affect the acid-base balance in the body. Acidosis. The blood has too much acid or too little base. This results in decreased blood pH. Alkalosis. The blood has too much base or has too little acid. This results in increased blood pH. The condition is known as alkalosis. Normal pH. Normal pH ranges from 7.35 to 7.45. If the pH is less than 7.35, it results in acidosis. If the pH is more than 7.45, it leads to alkalosis. In a healthy adult, various mechanisms help to maintain the pH of blood between normal range. These systems are buffer system, exhalation of carbon dioxide, and kidney excretion of hydrogen ions. Let us begin with the buffer systems in the body. So what does buffer system do? Buffer system prevent sudden change in the pH of body fluids by converting strong acids and bases into weak acids and base within a short duration of time. How does converting strong acid and bases into weak acid and base help? Strong acids lower pH more than weak acids, as strong acids release hydrogen ion faster. More free hydrogen ion leads to change in pH value. Similarly, strong base increases pH more than weak base. Buffer systems of the body are protein buffer system, carbonic acid and bicarbonate buffer system, and phosphate buffer system. We will first see the protein buffer system. Protein is composed of amino acid, which contains at least one carboxyl group or COOH and at least one amino group, that is NH2. These two are the main important components, working groups of these buffer system. The free carboxyl group at one end of the protein acts like acid by releasing hydrogen ions when pH value is to be lowered. This is how hydrogen ion is released from COOH group. It gives away a free hydrogen ion. The amino or NH2 group at the end of the protein can act as a base. This happens by reacting with H+ when pH falls in the blood plasma. As it removes excess H+ ions, the pH rises. The following reaction takes place. As you can see here, the amino group or NH2 reacts with H+ ions so that they are removed from the blood plasma. So now we understand that the protein can act as both base and acid. Example of blood protein include hemoglobin and albumin. These are blood proteins which act as buffer systems. The second important buffer system is carbonic acid and bicarbonate buffer system. It is based on bicarbonate ion or HCO3-, which acts as a weak base, and carbonic acid that is H2CO3, which acts as a weak acid. Bicarbonate ion or HCO3- is an important ion present both inside and outside the cell. You can see in this picture that bicarbonate is both present inside the cells and outside the cells. Kidneys also reabsorb this ion, so it is not lost in the urine. If hydrogen ion increase in the body, bicarbonate reacts with them and removes excess amount of hydrogen ions. As you can see here, bicarbonate reacts with hydrogen ions to form carbonic acid. This way, excess amount of hydrogen ion is removed from the blood. Whenever hydrogen ions are in shortage, carbonic acid can break down to form hydrogen ion and bicarbonate. This fulfills the need of hydrogen ions in the blood. The third and important buffer system is phosphate buffer system. It works in a similar manner to carbonic acid and bicarbonate buffer system. The components of phosphate buffer system include dihydrogen phosphate, that is H2PO4- and monohydrogen phosphate or HPO4-2-. Dihydrogen phosphate, that is H2PO4- reacts with OH-. OH- is a strong base. As you can see in this reaction, it gives water and HPO4-2-. As a result, OH- is removed from the blood. Monohydrogen phosphate, that is HPO4-2-, reacts with H+ ions, which are released from strong acids. It gives H2PO4- and as a result, it removes excess amount of H+ from the blood. Let us now discuss how exhalation of carbon dioxide works as a buffer system. Breathing also plays an important role to maintain pH of the body. If carbon dioxide increases in body, the concentration of hydrogen ion increases in the body, thus lowering the pH value. You can see here how carbon dioxide can increase hydrogen ions. It reacts with water to form carbonic acid, which is a reversible reaction. Similarly, this carbonic acid further breaks down to give H+ ions and HCO3-. In this way, carbon dioxide decreases the body's pH value. In case the carbon dioxide decreases in the body, it leads to increased pH value. If the pH in the body decreases, blood acidity increases. pH decrease is detected by chemical sensors in the brain, which sends the signal to respiratory muscles to contract with more force so that more carbon dioxide is released at the level of lungs. If pH in the body increases, the brain sensors are stopped to send any signals to the respiratory muscles, and the rate and depth of the breathing decreases. Let us now see how kidney acts as a buffer system. Kidney helps to maintain the acid-base balance as the PCT or proximal convoluted tubules and collecting ducts allow hydrogen ions to enter from the blood. Collecting tubules have special cells that further help to pull more hydrogen ions into the tubular secretion or urine. It can have a reaction where carbonic acid breaks to give hydrogen ions and bicarbonate. Hydrogen ion is sent to the tubule and bicarbonate moves into the renal capillaries, which forms renal vein eventually. So the kidney help by releasing hydrogen ions in urine and sending back bicarbonate in the blood. In this video, we have discussed about acid-base balance, protein buffer system, carbonic acid and bicarbonate buffer system, phosphate buffer system, carbon dioxide exhalation as a buffer system, and kidney buffer system.